I would say that the biggest issues that we're looking at least in terms of the border points, is because, again, the patient population is primarily women and children. So any kind of maternal issues, especially if the women are pregnant, so anything linked to that. There has been reports of women delivering on the way, or actually having to deliver in vehicles at the checkpoints. So that's one issue. So delivery or any kind of complications linked to that. Any kind of general reproductive health issues that women might have. And then obviously pediatrics. So we saw, children right from, a few months old, all bundled up, right up to teenagers. So anyone who's still allowed to cross the border. So any kind of pediatric illnesses, respiratory illnesses, obviously diarrhea, so any kind of childhood illnesses. And then, like I said, there's also, because they're in the cold, and children are far more susceptible to thermal injuries, things like that. So I think that's another thing that we would be quite cautious of. So there was a few patients admitted to the hospital. Another thing we're obviously thinking about this is more longer term, is that now a lot of children, especially if they move, will miss vaccinations. So that's something more long term we need to also keep in mind, and if anything can be done, because a lot of children receive those immunizations at this age, and now if they're moving, they're going to miss appointments. So this missed opportunities of vaccination. COVID still exists. There's no kind of screening methods at the border. We did not see anyone on either side masking. There's obviously no social distancing existing. Ukraine has one of the lowest COVID vaccine rates in Europe. They are able to get, and we heard it on the radio in English when we were coming to Ukraine, that people that enter into Poland can receive free vaccination and or treatment in Poland. So at the border, they can receive a vaccine, and there's also testing. But we didn't see a lot of people going into that in the limited time we were there. So it generally seems to be that, there is a very high potential that there could be another outbreak, given that these people have traveled long distances, been in confined areas, been confined at the border in close proximity. So this is another issue. Or generally anytime you put large groups of people in confined areas, there's always a risk of any type of any kind of infectious disease that can rapidly spread. Measles is one in particular that can spread very rapidly, especially if these children have not been vaccinated. So I think that's another thing we need to be wary of.